Welcome everyone to today's WAS monthly webinar on Get It Right the First Time, abstract submission advice from the WAS Congress Scientific Chairs. My name is Renee de Klerk and I'm the Executive Director of WAS, and I'm very happy to be your host today. The World Association for Sexual Health is dedicated to advancing sexual health, rights, justice, and pleasure for all. Through these webinars, we aim to share knowledge, encourage discussions, and engage with experts worldwide on critical issues affecting sexual health. So today, I am actually really close to the Botswana border. I'm still in South Africa, so if my internet is a bit choppy, I am really in a rural place today, so please excuse that. But please tell us where you're from so that we can see where everyone is joining us from today. Obviously, the views shared here today are those of the speakers and may not necessarily reflect the official position of WAS, although today I'm pretty convinced it will, because the two people that's joining me today are our scientific chairs, so they really do represent WAS very well. We follow the WAS Sexual Rights Declaration. Our information is evidence-based, inclusive, and culturally sensitive. Captions are available, and live translation is available in multiple languages. Please just select your preferred language using the interpretation button. We encourage engagement. Use the Q&A box for questions and the chat for general discussion. We'll try to answer as many as possible, but not all may be covered. So on that note, I would like to inform everybody for today, if you haven't got the latest version of Zoom, you might not be able to see the Q&A button. So just for today, you can post questions in the general chat. WAS promotes informed, healthy, and positive sexual behaviors for all. A recording of the session will also be available, and it will be shared via the WAS newsletter after the event. Please stay connected with WAS, and please consider joining WAS as an individual or organizational member if you are representing an organization today. And then mark your calendars, please. As always, the 4th of September will be World Sexual Health Day again. We recently started talking about our theme for this year, and our theme for this year is everybody. Please go to the World Sexual Health Day website as well and start engaging with the material that we provide for World Sexual Health Day. So now I have the privilege of introducing our wonderful speakers for today. First, I am going to talk a little bit about Kristen. So Kristen Mark, she's got a PhD, and she is the Joycelyn Elders Endowed Chair in Sexual Health Education, and is a tenured professor in the Department of Family Medicine and Community Health and the director of the Center for Women's Health Research at the University of Minnesota Medical School. She's a sex and relationship researcher, educator, and therapist with a focus on sexual pleasure, advisory committee of the World Association for Sexual Health, of course, and the co-chair of the WAS Scientific Committee. And apart from that, Kristen is just a beautiful person. She posts wonderful videos on Instagram every so often, where she shares some of her research. She recently became a beautiful mom, and We wish her all the best for her family. And just from me, Kristen, I want to thank you for everything that you do for us. We appreciate you and we love you. So, next speaker, of course, is Terry, her co-chair of the scientific committee. Terry is also a professor and a graduate director in the Department of Psychology at Trent University. Oh, and that really difficult place that I can't pronounce. Maybe Terry can give me a shout out in Ontario, Canada. His research expertise focuses on the negotiation of sexual consent in multiple contexts, sexting behavior in young adults, and first sexual experiences. Um, Terry Humphreys is currently the editor-in-chief of the Canadian Journal of Human Sexuality, a consulting editor for the Journal of Sex Research, and a co-chair, which I've already said, of the scientific division for the World Association for Sexual Health. He's also a past president of both the Society for Scientific Study of Sexuality, QUADES, in the United States, and the full. So you all know that you are in very good hands, as you can see, with very good academics that know a lot about publishing and writing. And they will now tell you exactly what you need to do to be ready for the next WARS Congress, which will, of course, take place from the 2nd to the 6th of September in South Africa, in Cape Town. And you will soon get more news about the Congress. Thank you, Kristen.
Great. Thank you for that introduction,
Okay.
Renee. I'm going to turn it over to Terry, and it's pronounced Peterborough.
Peterborough, yes. Peterborough, it's a funny little city, small city here in Ontario. Well, welcome everyone from around the world um, to another free webinar on behalf of the World Association for Sexual Health. I am Terry Humphreys, one of the co-chairs here, and the co-chairs of the scientific division, actually, that has been expanded in recent months and to include primarily still the Congress Committee, which is the biggest committee that we are in charge of, the charge of the content of the International Congress that happens every 2 years. But we also now have a scientific and research committee that reviews all of WAS's statements that they release, and a gold medal committee that reviews the candidates for awards at the Congress. So it's become a very large part of what WAS does. So today we're going to focus on trying to provide you with a little bit of a practical guide to submitting a quality abstract to the upcoming WAS Congress. Some of this webinar, we will discuss things that are basically best practices of submitting a research, research anywhere to any conference. But other pieces of it, we're going to highlight what WAS's process is and how it works and how our scientific committee kind of evaluates submissions. So let's move to the first slide, please. The first thing I would like to note here is that WAS has a bunch of different tracks that we try to funnel a lot of the research. I mean, we're given an overwhelming variety, and WAS handles an overwhelming variety of different sexual health research areas, and we accept all of it. So it's very important we have a way of organizing it, and this is one of the processes that we do. So we have a whole bunch of different tracks. I think in Australia, our last Congress, there was about 7 tracks. These are just examples of what tracks look like. These are not the ones that will end up being the tracks that we will follow when the call for abstracts goes live. But these are I'm just providing these as examples of the kinds of tracks that you can expect. So, for example, if your specific research is on female sexual dysfunction, you might select a clinical track for your research, for your abstract when you're submitting it. Likewise, if your research is on abortion or reproductive justice, you might decide to select the track that deals with law, policy, or ethics. So these are the types of things. This is one of the boxes you'll have to check when you submit your research as to kind of where it falls in this grand scheme of sexual health research that we do. Um, so where does it best fit? And it's really a best fit. Likely a lot of research is going to overlap some of these, and you'll have to figure out where your predominant emphasis is going to be in choosing one of these tracks to fall into. And part of the reason that we do this is actually that we need to have a whole bunch of experts who are in all of these particular areas that are going to review these abstracts. WAS is a very large group of international volunteer experts in each of these tracks that's going to help us review the overwhelming amount of abstracts that we will get. So this is an international review board that will review and score all of these abstracts that we receive. No small feat. So we want to be sure that someone familiar with your general area has eyes on your abstract, is reviewing your research. Okay, next slide, please. So let's actually move to some advice on what makes a good abstract submission for the WAS Congress. I think mainly, the core criteria that our reviewers are going to use is this idea of scientific merit and originality. So what does that mean? Well, is this new knowledge generation? Are these new insights that you're providing to the field, your subfield, or new innovation in that area, new practice, for example, new education, new intervention? So it needs to demonstrate a rigor, credible research, practice-based evidence. And these types of submissions do typically follow a structure. So you want to be able to, make sure that you're following a well set out structure. And this is a structure that is used in most conferences, but specifically for WAS as well. So we're looking at making sure you have a very clear objective and purpose in that abstract right up front. What is the main, issue? What is the main purpose of the research that you're conducting? Why is it important, right? And then methodological rigor. Obviously, how did you go about collecting that data? How did you conduct that research? So those methods need to be well laid out, how it was done, followed by results. And we actually, I put there in brackets, actual findings. So this is not something that you will, data to be analyzed later for submission, but you need to actually include at least the preliminary results of your findings in there, so we can properly evaluate the veracity of the research that's being done. So actual results, and then, of course, what does it mean? Well, what is the conclusion? What is the implication for the field or your subfield? So those are kind of the essential ingredients to make up an abstract, and Kristen will follow up with that in a little more detail. We do obviously also want to leave a lot of room for your Q&As, so we're going to do a quick overview, both of us, and then we'll open it up for questions. So within that structure that you write, and you have a word limit, typically somewhere around 300, 400 words that you'll need to contain it, so it needs to be concise. So quality matters here too. Clear, descriptive title to give us a clear indication of exactly what the abstract of the piece of research is about. Concise writing, so within those word limits. Keep it tight, keep it precise. Obviously, accurate spelling and grammar is important. Our reviewers only have so much time, and English language is required for the Congress. And of course, no tables or figures pasted within abstracts. So it's just the text itself. There is a usefulness, I think, to aligning your specific piece of research or clinical practice to the Congress theme as well. So tell us how it fits. That could be part of your clear purpose to submitting to us, or part of the implications or the conclusions as to what it means for the field. But that alignment is useful. So we build our congresses around particular global themes: sexual health, rights, justice, pleasure. Make sure that your piece of research connects with that in some way. So what are the global priorities in your area or even in your region, and how does that connect with the themes that WAS is promoting? And then kind of this idea of what high scoring abstracts typically look like. So although WAS doesn't really publish any of its rubrics, and certainly those are privy to the international review process, it's going to align with some pretty typical things that you might imagine. Is there a clear problem or rationale in the abstract? Is it appropriate and well-described methodology so we can evaluate the research that's been done? Are there concrete results? So, making sure that there is data there, not just promises of data. Are the conclusions actually supported by the evidence that is presented? So not going beyond the results that you have. And does it have strong public health or clinical significance? So all of these types of things are kind of integral to a well-worded, well-crafted abstract for WAS. And then a lot of that kind of mirrors a lot of standard scientific review frameworks in many global conferences, but especially here at WAS as well. So I think I'm gonna end there. It's relatively basic information, I think, but I think we all need to have a good refresher on it every once in a while. And I'm gonna pass it over to Kristen to talk more about some red flags and green flags for abstract writing. Kristen.
Yeah, and thanks, Harry. I'll just add one more thing. I know that we've mentioned data quite a bit here, and I understand and WAS accepts that not all research or not all abstracts may have specific data associated with them. Maybe you are presenting on a really innovative education session that you created, and you want to share the dimensions of that education session. That's okay too. You may not have specific data, but you will have a specific research question of what it is that what do you hope that the audience will take away from your presentation? And so that will be your objective and your purpose. You will have a clear method in that case, which would be how you created this curriculum, and I'm using curriculum as an example, but there are so many different ways that this looks, right? It could be a curriculum, could be a workshop, could be some advocacy effort that you've engaged in. Then I think when we get to the results, that's where we really need like concrete information. So if you collected any sort of information from attendees and have anything you can share on impact of that, number of people who attended, like actual concrete information about your workshop or curriculum or advocacy effort. And then what does it mean for the broader sexual health field? And why is it important, and who's it most important for? So I just don't want you to get caught up in, we're talking, most of the abstracts that we receive do have data associated with them, and there have been some really high quality abstracts that we've had in the past where maybe there isn't a specific research project around it, but it is there are data associated with it still. So I'll talk a little bit more detail, and if you have specific questions about your own work, like we can answer those questions in the second half year. As Terry said, we want to reserve as much of this as possible for that. But I'm going to talk through a few abstract red flags, and that'll give you an indication of when and why abstracts end up getting rejected from WAS, because I think it's helpful to know what not to do as you're preparing an abstract for review. So some like writing or content related red flags that come up are things like if we see really buzzword heavy or content light types of abstracts where there's lots of jargon, but there's very little substance, where after I finish reading it, I ask myself, what did they actually do? That sounds great, but because it's got lots of this like buzzworthy sort of wording, but there's no actual substance to it. That's a red flag for us. And so that means that maybe important details were omitted. So things like the sample size, the population, what were the outcome measures, what were you most interested in understanding? Details like the with the results as well. So Terry mentioned this, that you do need to provide actual results. And that means saying, here's here's the analysis that we did, and here's what we found. Or if in the cases of the other types of abstracts that I just mentioned a couple of minutes ago, the results being, we found that this workshop was effective based on this information, right? You're going to want to really list out the specifics of that to provide us with something to evaluate. Another thing that's a red flag for us is when there's a real mismatch between the title and the actual content. I think it can be tempting sometimes to come up with a really catchy title, right? And maybe even a title that makes that draws this big conclusion. um, and that is not very helpful if the results and the content don't match up with that. So we really want you to be have that title reflect the actual content. Also, if data collection is incomplete or the stage of the research is unclear, sometimes researchers will indicate that data collection is still underway. That's a red flag for us because, for one, a lot of things go wrong in research across time. And how do we know that you're going to have your data in time? And two, if we aren't sure, if you haven't finished collecting your data, then we actually don't know what the findings are, and the findings are the most important part. So we need to be you need to be submitting work that is complete or that is at least very, very close to complete, where you can provide actual findings to us. So that's an important piece here that I think sometimes people think they can just sort of say, like, we've collected some of the data, but haven't analyzed it yet. Data will be collected in time for the Congress. And I know that we ask for the abstracts really far in advance, but that just means you can save that work for the next Congress if it's not quite complete, and really share with us work that is complete. In terms of study design and methods, some red flags here are if you don't have a clear research question or a clear objective of your abstract. Like, what is the purpose? We need to know that. Or if the methods don't match the question. So often people will propose a research question and then they'll use a methodology that doesn't actually answer that research question. And so that can also be seen in red flags of vague methods where it's just not specific and we can't really tell what was done. The purpose of a methods section is for someone to be able, in a paper, is for someone to be able to replicate your study without having to ask you any questions. In an abstract, you don't have enough space to do quite that, but we do want to be able to see, like, okay, they used this analysis, they had this type of data, they used this analysis, and they collected their data in these ways. Great. Additionally, if you have a really small sample size and you don't acknowledge that it's small sample sizes aren't deal breakers. In qualitative research, for example, we often have smaller sample sizes, and that is totally fine. But there does need to be an acknowledgement if, say, you have a quantitative study and you have a small sample size, if it's a pilot study or something like that, you need to acknowledge that it is a pilot and let us know, really be explicit about, despite the small sample size, you could say, despite the small sample size, significance was still detected and we found this, like whatever that, that's not probably quite how I would write it, but that is, it's important to just acknowledge that there. And then another red flag around study designer methods is if you talk about your findings as if they're generalizable when you use something like a convenience sample. So if you collect data from medical students at one particular university, to say that that's generalizable to the entire public or to another region, or it's very you would need to have pretty strong arguments for generalizability if you're going to generalize beyond your sample. So I just suggest, especially in the context of an abstract, it's not a limitation that your data is not generalizable. The purpose of research isn't always generalizability. So that's okay. Just accept this was done in this sample in this population, and we found this, and that has implications for this, right? That's great and makes a really good contribution and a really, really solid contribution. Yeah. Some analysis red flags that we look for, or that pop out, I guess I should say. We don't necessarily look for these red flags. These are just things that do pop out to us, is when there's that unclear hypothesis or research question. Another thing is, if you are doing statistical analysis, it's really helpful to include effect sizes in addition to p-values. So p-values are great and important, and they're the first step. It means that it's statistically significant. But without an effect size, we don't know if it might just be pretty trivial in terms of findings. This is especially the case if you have a really large sample size. So if your sample size is quite big and you're not reporting effect sizes, that's a red flag to me. And then overclaiming from underpowered data, that's another, it's very much related to that. I think just be careful with the extent to which you generalize those findings. And then also lack of clarity in the type of analysis used. It's really important to state what analysis you did. This is true for qualitative work. If you're analyzing interviews or focus groups, we want to know, did you do content analysis or did you do thematic analysis, or what type of analysis did you do in analyzing these data? For quantitative, let us know what type of analysis you did, because that's how we can evaluate whether or not the research question could be answered or the hypothesis could be tested. So I think I'm going to leave you with some quick questions to ask yourself as you prepare your abstracts. And those include, in reading this, can I identify the question, the methods, the sample, the results, and the conclusion in 30 seconds? Additionally, does the conclusion logically flow from the methods and results? Is that conclusion supported by what you found? And then I think the most critical piece to ask yourself is, if I wanted to trust what I'm reading here, if I want to trust this abstract, what information might be missing that I would need to be able to trust this? Especially with the increase in AI, in people utilizing AI to write these things, these are critical questions that we as the review committee are going to be asking, because these are the types of things that things like AI miss, right? This is the work that we really want. This is where the human impact of all of this really comes in, is like, what's the take home message? And is that supported by what I did here? So if you ask yourself these questions as you're writing the abstract and you can answer those questions, I think that's a really fantastic start. So now we'd love to hear what questions you're left with. And wow, we're on perfect time. This is exactly, we have exactly 30 minutes left for us to just have a discussion. What are some of the specific projects you all are working on that you're like, what kind of things should I be thinking about including in my abstract? And I know that it might feel odd asking a specific question related to your work, but I can promise you that whether there's someone who's here right now or someone who will watch this video later, they will have a similar question. So please don't be shy in asking questions that's specific to your work or specific to the type of work you're doing. Because I know a lot of our WAS community, as I mentioned right after Terry was talking, a lot of our WAS community may not have sort of traditional scientific abstracts, and we do really love having abstracts that reflect advocacy and education and clinical care, where the evidence might not be sort of the traditional scientific evidence that we think of, but that doesn't make it not evidence. So please, if you have specific questions related to that, let us know. And yeah, we will certainly look forward to that abstract portal opening, and really hope to see you at WAS 2027 in Cape Town. So I'm going to stop sharing my slides and just open it up to any questions. And I see that we've got one question here, or a comment at least. Let's just unshare here. Hold on. There we go. And Valerie's commenting about sexual pleasure in the context of female genital cutting or mutilation. That's great. There's lots of really fantastic work being done in that area. I'm involved in a project where we're training future healthcare providers in Tanzania to address issues of female genital cutting in the context of sexual health, and would love to hear from your work as well in that area. So yeah, what do you have any questions, Valerie, about like what to include in that work? I think one of the other things that I will say is, especially with a topic like female genital mutilation or cutting, there are sensitivities.
I
Oh,
I think I would like to know if you have, is there sort of very typical mistakes that people make where when you are reviewing an abstract and you get to, you know, sort of the hundredth one where you go, oh my goodness, they did this again. Um, are there specific ones that stand out for you, um, that you feel you often receive specifically for the WAS conference? I know you already mentioned the the one about, please don't tell us that, the research is not finished at this stage, then you have to leave it for, another conference. But perhaps are there any sort of tips that you can maybe give people that are still in the process of doing the research to maybe adapt that abstract to a literature review or something else that would still be acceptable to come and present in a poster format, for instance, if they do not have the clinical, the actual data gathering process done yet. Because
yeah.
it's one of the things that you specifically mentioned, and maybe if there are any other, things that are so obvious that your abstract will be rejected, and you do see a lot of them. Maybe you can speak a bit more about that.
Yeah, I mean, in the review process, a lot of what the decision making that we do is to look for specifics in the methodology and the results sections. So you want to know how it was done and what was found. What is the major? You don't have to tell us everything that was found, but what was the major point of doing this research, and what did you actually find as a result of that? Whether it be a prevention program, an intervention, a clinical trial, or a piece of social science research, all of that. And when things are a little bit vague, or we feel that the data could use a little, it's not great, but it's it's acceptable. A number of reviewers, or as a rule, will simply flip those to posters. It's so we make decisions about whether or not the research is like it gets a a slot for someone to do an oral presentation, or whether it's like, okay, we can relegate this to a poster. So some of those decisions are being made along at the same time. So depending on the quality that we review in those abstracts, we can decide which venue that it's most appropriate. And sometimes if there is some vagueness, but it's like it's a unique particular topic area or something innovative, but not, has preliminary data attached to it. It's like, okay, well, let's take it, but we'll accept it as a poster and not an oral talk. So those decisions are made by our International Review Board as well. And those are the
And
kinds of things that will split that decision in terms of the clarity of that abstract. Go
mhm.
ahead, Kristen.
Yeah, definitely. And I think that we based these red flags and based on the things that we do see often, right? I think that that does answer that question, Renee, of like, what do we see often that are red flags for us? And I think that there's also one thing I didn't mention that Valerie's note here reminded me of is we aren't so and Valerie, I'm not to use that as an example because I'm sure that yes, you will. I'm sure that you will provide us with a fantastic abstract. But I think sometimes in these areas where there's strong like the topic of male circumcision is one that is just a very hot button topic. And that is one where like if you are just providing your opinion about it, it's not going to get accepted. You need to provide, and that's true for any topic, but we just tend to see it more often for some of these more controversial topics. And so if you are, no matter what you're submitting, it can't just be like, my personal experience was this, and this is my opinion on this issue. It has to be rooted in science and at least rooted in the scientific background of that information or of that field, the scientific background. And then maybe it's, and I did a systematic review of the literature on this, and I found this. Or I am doing a literature review on this and I'm creating a research study and would love to receive feedback from the WAS attendees on the design of this research study to really get at this research question. That would probably be a poster, but it would be a fantastic poster because you would have the opportunity then to talk to all of these different people about your work and get feedback on that method. So, something that's in progress it doesn't mean that you shouldn't submit it at all, but I think you need to be very clear with something that's in progress of what the purpose of sharing it with the WAS community is. And that is part of your results and your conclusion, right? Like, I hope to learn about, what people think should be included in this. And it can't just be your opinion.
Yeah. And Renee brought up the point about lit reviews or systematic
Yeah.
reviews or meta-analyses of the data, and those are completely appropriate as well, as long as what you're doing is coming up with a unique conclusion, because that's the results section of any review. It's like, I did a systematic review of this subliterature and found something unique that I'm going to speak to. So after synthesizing all that, I've come to a new revelation about this area. That's the finding, right? So those are completely appropriate because there is an actual results section to that, your analysis of it, and a conclusion. Yeah.
Yeah, and with that, like to use that example, if your conclusion has implications for clinical care, for
Yeah.
example, then you would categorize that abstract in that clinical care category.
Yeah.
If it has implications for advocacy, then you would categorize it as an advocacy abstract. So those conclusions really matter, and the implications of who this matters most for is a critical component of putting together your abstract.
Thanks so much. I think You are really providing our participants with some excellent advice, and I'm really excited about the fact that the webinar is being recorded and the fact that we can continue to post this information as we start to market the Congress for next year. What I would like to also ask you to perhaps comment on, if we can sort of provide our audience with a sneak peek, are there any specific areas or themes in research that you, as the scientific chairs, would like to see research in? So, not that we have any favoritism in WAS towards, specific research, but there might be some of your own research where you found some gaps recently and you would like to see other people do research in those areas and they might bring some interesting stuff to the conference. So, what is it that you are particularly interested in, and what you, as the scientific chairs, would like to see future researching? I don't know if that's a trick or a difficult question, but perhaps a little fun conversation to have.
Well, it's certainly a fun conversation to have. I mean, there's so much innovation happening, and when you talk about the future of sex, AI is becoming front and center. And I started doing research on just sexting behavior, which is people using their phones to send messages back and forth, send sexy messages back and forth, and the motivations and reasons to do so. But AI can take over that process fairly easily, and AI is now seeping into many fronts. So you can have AI to assist you with generating actual research. You can have AI assist you in your pleasure seeking, because there's all sorts of AI could essentially take over the porn industry, quite frankly. There wouldn't need to be actors and actresses anymore. They could generate all of the characters that looked realistic enough. So what is that going to do to that industry, or what will it do to our sense of pleasure and connection with others? So that's a fascinating kind of area that's just starting to produce some snippets of research in the field, but there's the ways in which AI is going to influence sexual health on an individual level, but also even on a research level, is I don't even know the language to talk about the expanse that will happen as a result of it. So that's one area, one feature.
Yeah,
Yeah,
and
thank
that is
That's
really
really
interesting. And I do think that I think that there's I'm really interested in the intersectionality of that. So like who is that benefiting most, and who gets access to that?
Right.
And then what are some of the implications of that? Like we think about the global health, the environmental impact of AI. And if we are going to, I think we need to in some ways embrace AI, but when it comes to sexual health, how is that impacting people's sexual health in the long term? And I think some of those, I don't expect people to have research on that. And that brings up a very important example of like that would be a really interesting oral presentation for someone to do, like what could be some of the projected implications of this in looking at the science of all of that so far,
Mhm.
right? And then I think also I'm really interested in I mean, I study sexual pleasure and sexual satisfaction and maintaining that over time. And I think some of the pieces that are interesting to me are like how we're integrating messages of sexual pleasure in places where pleasure wasn't previously talked about. Um, And that is what you're doing, Valerie, in your work. Sorry, I keep picking on, I keep pointing out Valerie's
She's
work,
the
but
only one that's asked
that's
a question, so
the only one, yeah, who's posted something, so it's easy.
we're going to talk about Valerie.
Yeah, but I think that that's amazing to integrate pleasure into an area where pleasure is not normally talked about. And I think that gets at some of these intersections too of who gets access to that pleasure and who doesn't. And so I do a lot of work in medical education. How can we integrate more sexual pleasure into medical education for our future healthcare providers to ask questions about sexual pleasure and not just function? And I think these questions around function are important. And we are interested in engaging industry a little bit more extensively in this Congress than we have previously. So, also thinking about what are some of the clinical implications of the work you're doing, and questions like why should pharma care about pleasure, right? What are some ways that they could measure that they could start developing more clinically conducive measurement tools for improving pleasure for people? I think those types of questions are things that we're going to be looking for of what what's relevant to what audiences and how are people considering the global context of all of this as well. Um, so those are some examples that come to mind in just like you asking that question, Renee.
Thanks, Kristen, for that. I just want to comment before we have quite a substantial question that just came in the chat, which I will address now. But just on the topic of AI, Terry and Kristen, I would also like for you to perhaps comment on the use of AI with compiling your abstract. Because,
Mhm.
Yes.
we're not only using AI for in our relationships these days, people can also use AI to compile their abstracts for them. And perhaps just some comments, you're also editors of journals and very involved in public publishing. So just commenting on the ethics of that and how you may or may not use AI.
Yeah, I mean, from my own perspective, and I think this is a perspective that's broadly shared across academia. I think there's value in um, cleaning up your language if that's you can draft your abstract yourself with all the pertinent information, obviously the clarity around the methodology that you've used in your research and your practice oriented findings, and then what it means. But there's nothing necessarily wrong with just cleaning up the language a little bit. So, your grammar, issues like that, some
Yeah.
typos, things like that. That's completely fine. But AI will tend to like it'll take your paragraph or whatever it is and kind of massage it and generalize it, and you want to be careful about what it does to the actual methodology and the findings that you have specifically put in there. You don't want it editing, changing, or generalizing it too much, because that then becomes a red flag for us when we say, oh, they've generalized to a broader audience that they can't. But AI might have done that for them instead of them being very careful in proofreading after they put it through a generator. Kristen?
Yeah, and I think particularly with WASP being an international organization and the fact that we do require abstracts to be submitted in the English language, I think that's really limiting for a lot of people. And therefore, I welcome the use of AI in improving the English, translation of your work. But as Terry said, proofreading that afterwards and being really certain that it hasn't lost the nuance, because what AI does is it really leans into jargon and it really makes you read a sentence and say, wait, that sentence is saying nothing at all.
Yeah.
So read those sentences and be like, is this saying something? Is this actually saying something of substance? Because if it's not, I just think AI often erases the substance and replaces it with jargon. So just be very careful with that.
Yeah.
But absolutely, it can be a great tool, especially for folks where English isn't their first language, to be able to submit something. And I'm noticing the time and do want to make sure that we get to Yuri's question here, because that speaks directly to what I mentioned earlier, where this work that you describe here is absolutely within WAS and within our scientific, like we want this work. This is so important. And so for practitioners who are working in implementation and program management, so like comprehensive sex ed project with an NGO or practice-based learning, your methods are, so it depends on your research question, right? Is the purpose of sharing this with WAS for you to share the specific curriculum or share the process of the program? Or, are you wanting to talk about process? Are you wanting to talk about the specific curriculum? Are you wanting to talk about impact? Think about what you specifically want to talk about, and that will really shape what you put in each of those sections of the abstract. We want to hear from you about what are, practice-based findings from monitoring, evaluation, implementation. All of that is appropriate contributions, absolutely. And all of those are considered data. So perhaps this might have been like it might have been something where you didn't get IRB approval because the purpose of it is to see how the implementation works. That's okay. We want to hear about those findings because those are really relevant to people doing the work, and people on the ground. So is it a lessons learned talk? I think that's the question you need to ask yourself in this is what type of a talk is this? Is it a lessons learned? Is it here's the curriculum, go use it? Is it we would love all of that work. I think that work is critical to WAS's mission and is critical to our scientific mission as well.
Great.
So, did you want to comment any more on that, Terry, or can I just perhaps say a few words about?
I'm pretty good with that. I would just say that I'm not sure if people noticed, but one of the example tracks that was put up there was regional development. So, there may be lots of research in a particular area that has been done, predominantly in North America, but has not been implemented in other locations. And what are the
Yeah.
lessons learned in those locations? We want to know about that for sure. So that's absolutely part of WAS's mission. Thank you.
So there is a lot of opportunity for some replication studies in other contexts,
Yeah.
which can be presented specifically. We are always interested in the Global South. And what is really amazing about our WAS 2027 Congress is, of course, that it will be on African soil for the first time. So this is just a reminder to our audience and our participants that we are super excited about the fact that it's going to be in Cape Town for real this time. So in 2021, the Congress was supposed to take place in Cape Town, and then it couldn't happen because of COVID. But yes, come hell or high water, we hope we will be in Cape Town. And because I am from South Africa myself, I am South African, and I'm very, very excited to also tell you that, or hoping that you will all come and see our beautiful country, and of course tell you that South Africa makes absolutely beautiful wine. And just surrounding Cape Town areas are beautiful wine country. So that's also something to come and see and look forward to. And we really hope that we will see all of you and many more, and invite your research buddies and your friends and everyone who's interested in sexual health to come join us at the Congress. And in the meantime, please stay tuned and make sure that you engage with this year's theme for World Sexual Health Day. Everybody, I can perhaps just say a few more words about it, and that is really that the focus this year is the fact that we all arrive in this world in a body that we didn't choose. And not all bodies have equal access to health services. unfortunately, and that links to the theme of sexual justice. So we are looking at all kinds of bodies and just really reflecting on the ability of those bodies to access sexual health and rights. Maybe you're in an aging body. Maybe you're in a perimenopausal body like I am currently. Maybe you are in a pregnant body. Um, Maybe, you are in a critically ill body at the moment, and that comes with consequences. And just thinking about some of the beautiful presentations that I've seen at WAS congresses about how cancer and illness can affect the way you experience pleasure and how your body changes. So we are thinking about and reflecting on all of the different bodies and how that influences the way we experience sexual health and rights and our access to services. So please go to the World Sexual Health Day website and also start thinking about what you are going to do this year for World Sexual Health Day and how you would like to celebrate and engage with our toolkit that we will provide. And we really want to encourage everyone to host their own little event for World Sexual Health Day or do your own, even if you invite friends over and just have a conversation about how are we thinking about our bodies and how are we having grace with all of the bodies around us. So I think thank you so much for our guest speakers. And I just feel a little bit awful towards Terry because I told Kristen that she's a beautiful mom and I didn't give you some kind of special treatment, Terry. So afterwards I was like,
It's okay.
I was very nice to Terry. I should give him a compliment as well. But Terry, just thanks for always being there and always
Yeah.
contributing towards and being a great sport and always having a smile on your face, even if you join a meeting, 5 o'clock in the morning or
Yes.
whatever. I'm sure, yeah, we are very grateful.
It's all good.
Um, you can give a hand to our wonderful chairs of our scientific committee, really. They are volunteers. They work for WAS on a volunteer basis. So we are truly grateful for you and your time. And thank you for everyone who joined this webinar today. We are really going to post it a lot, especially, in the coming time just before the Congress as well. So we'll keep sharing this knowledge and also share it with your networks. Thanks, everyone, and thanks for joining.
Thank you.